did in the Netherlands was they took samples from 10,000 blood donations from all around the country. So this was people that were giving blood anyway for use in hospitals. So always a noble thing to do, but 10,000 people gave blood donations. And they tested all of these 10,000 donations for the antibody to see if people had developed antibodies and therefore likely immunity to the COVID-19 virus. And what they found was 3% had antibodies to COVID-19. 3%. But I've been thinking about this, and I can think of no reason why blood donors were more likely to contract the virus than anyone else. So I think in terms of viral exposure, they're likely to be quite a representative sample. Now, the population of the Netherlands is 17.3 million. And 3% of that, according to my calculation, is over 500,000 people. So the number that have been diagnosed with testing, we can see is 10, 15 times less, perhaps, than the number that is probably actually infected. So I haven't done the sums, but that's about times 15, isn't it? And we have been saying this for quite some time on this video series, that perhaps 10 to 20 times as many people are actually infected with the virus than are showing up on the testing statistics. So I thought that was really quite interesting. Now, we noticed that if there's that many deaths and that many cases, that gives us 11.2%. So 3,459 is 11.2% of 30,619. But if the actual number of cases, as now looks likely, is over 500,000, then that brings the death rate down to about 0.66%. Encouraging. So it's starting to look like, and we've been speculating about this for months now, that the final death rate might be round about just over 1 in 200 people that get infected end up dying from COVID-19, at least in Europe. This was a Boston homeless shelter, Massachusetts. Pine Street Inn homeless shelter, Boston, Massachusetts. And a small cluster was identified in the area. So what the authorities did, they went and tested everyone in this homeless facility. They tested everyone. And they tested 397 people. And 146 of them were positive. That's 37% were positive. Now, this is what's really fascinating here. These 146 people, 37%, at the time of testing, it's just a few days ago, I'm not check on the article for the date, but they were all asymptomatic. None had symptoms. So as we looked at in the New England Journal of Medicine study yesterday, it's looking like the number of asymptomatic people is much higher than we had previously thought. And as we've said many times, people without symptoms, it's great for them. They'll get the virus, hopefully they'll develop antibodies, hopefully they'll develop immunity, but of course they can be spreading it on to other people. That's the downside. That's why I'm in favour of wearing masks now in all public places like supermarkets. I've changed my opinion on that. So a lot asymptomatic. Now since one of those 146 has needed hospital care, so the last news report I got, still 145 of these remained completely asymptomatic. And this is quite incredible. It's looking like there's way more, as we saw in Netherlands, it's looking like there's way more of this infection has spread around than we thought. And it's looking like way more people are asymptomatic than we thought. So this means, this is the good news, that we could be further on in this pandemic than we'd thought. And there could be much more herd immunity around than we had previously believed. Because if these 146 people all develop immunity, then that's a lot of people to block the infection. That's a good starter in the direction of herd immunity. And herd immunity, let's be clear, is the only way out of this pandemic. By people getting the infection and becoming immune, or by people being immunised via vaccination. They're the only ways that things are going to get completely back to normal. So that was fascinating. And on a similar vein, Stanford University. Now, Stanford University is in California, and it's a very prestigious university. It's quite I think it's what Americans call it a red brick university. It's one of their posh ones anyway, so it's a very prestigious university in California. Now, the proviso here is this is not peer-reviewed data, but Stanford wouldn't publish rubbish, and it's being peer-reviewed now as far as I know. So I've no reason to doubt this data at all. Now, what they did in Santa Clara County, California, they tested at random 3,330 people. Now, rest assured, Stanford University know how to pick a random sample. And they tested them for seroconversion. They tested them for the antibody, just with a finger prick test and an antibody test. Now, get this. Infection with COVID-19 by the people who've had the antibodies is 50 to 80 times more common than official figures. So 50 to 80 times more people have been exposed to the virus than have been detected with previous testing. So Santa Clara had 1,094 confirmed cases and 50 deaths. These are cases confirmed presumably entirely by the earlier antigen testing for the presence of the virus itself. And 50 as related to that number there gives 4.6% death rate, case fatality rate of 4.6%. But the antibodies, if you scale up to the population of Santa Clara, which is more than reasonable to do, and which is highly likely to be accurate, given that Stanford University would choose a very representative sample, so the scaling up is an entirely legitimate thing to do, and is almost certainly correct. Antibodies indicated that between 48,000 and 81,000 people were infected by early April, not that. So 50 to 80 times more actually were infected than had been detected. Interesting. Now, if this is the case, what I've worked out is with 50 deaths, the case fatality rate of its 48,000 would be 0.1%, 1 in 1,000. And the fatality rate if it was 81,000 people infected would be 0.06%. Now, to be fair, this death rate will rise because we know there's this big long lag time with deaths after infection. But indicating that about 3% of the population there is probably already exposed to the virus, so way more than we thought. Now, to get herd immunity, we're probably going to need 60 or 70% of people to be infected. So we're nowhere near getting herd immunity now. Now, I get complaints every time I say herd community. People aren't cattle, don't be offensive. But it's the term the epidemiologists use, so I'm not changing it. Herd immunity is the official proper term. It's not me being bigoted, it is the official medical term. So interesting, but we're not near herd immunity yet. But given that there's that number of deaths, that means that it looks like many fewer people are getting sick than we'd thought. Many fewer people are becoming critical than we'd thought because the numbers of people infected are so much higher than we'd thought. And therefore the death rates are much lower than we'd thought. But these could well increase and almost certainly will increase, as we've noted, unfortunately. So, interesting.